Starting Medicare can be unbelievably confusing, and I hear it every day on how complicated things seem to be to try and figure out exactly what it is you need to do, whether you're turning 65 or you're about to retire, you're going to come into Medicare. You need to make all these choices and all these decisions, and it can drive you crazy. So I'm here to help with all that. I'm going to make it as easy as possible. The first thing that we need to understand is your Medicare coverage choices. And it's really important because there's a huge difference. There's really one road to go down or another road to go down, and they go to different places. So we need to make sure we understand exactly what we're doing so we don't mess it up. If you're new here, I'm Keith Armbrecht. I'm founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. There's no cost to use me to help you. If you stay to the end of my video, I'm going to show you how to download a copy of my book, Medicare Made Clear. Absolutely free, no strings attached. It's yours to use. I have a lot of information in there, and I'll show you right at the end of the video how to get it right now for free. Right now, we're going to talk about Medicare coverage choices. So when you come into Medicare, what do? So your first choice is, do you stay with original Medicare or do you choose a Medicare Advantage plan? You've probably heard Medicare Advantage somewhere along the way because all those TV commercials primarily talk about Medicare Advantage, whether it's Joe Namath or Jimmy Walker, whoever it may be hawking Medicare Advantage plans. And that should kind of raise a red flag for you right there on how hard they push and sell these plans. And I'm going to explain the difference exactly right now. And I'll tell you why I do not recommend a Medicare Advantage plan. And full disclosure, I offer Medicare supplement plans that go along with original Medicare. I do not offer Medicare Advantage plans by choice because something I would not go on. I would not join a Medicare Advantage plan. I would not put my parents on a Medicare Advantage plan. And I would be uncomfortable putting you on a Medicare Advantage plan. I'm going to tell you exactly why. But right now, we're going to figure out the difference between the two. What makes them different? So you have original Medicare. And understand, if you stay with original Medicare, which is Medicare Part A, Medicare Part B, you will almost certainly get a Medicare supplement plan that covers what A and B do not. You will almost most certainly get a Medicare drug plan that covers your prescription drugs because original Medicare does not cover prescription drugs. So when we bundle all that stuff together, it's still low cost and very little out of pocket. I'm going to show you specifically what I'm talking about. So what I'm going to do right now is we're going to go to Medicare.gov and show you how they explain the difference between the two, and then we'll kind of get the real picture on somebody that's been around it for a long time. So when you go into Medicare.gov, and I'll put the link below this video, in their blog section they have on comparing the choices coming into Medicare. So the first section they talk about is cost. So what are the costs between the two types of original Medicare or a Medicare Advantage plan? And how they define it, on original Medicare, it shows you will pay the Medicare Part B premium, and that Part B premium right now is about $150 a month. So it's certainly a premium, but it's not an outrageous premium. But that's a whole different story on whether you find the need for that. It also shows that you're responsible for any co-payments, co-insurance, and deductibles, just like on any health insurance. And it says there's no limit to how much out of pocket you can pay. But you can buy a Medicare supplement plan that will limit the out-of-pocket. So with original Medicare, let's break it down a little easier. So you got about that $150 a month Medicare Part B premium. You're going to add a supplement to it. That supplement, our goal is to find a supplement plan that's close to about $100 a month. So we're going to add $100 a month for the Medicare supplement plan. A Part D plan is going to cost anywhere generally around $20, $25 a month. Depends on the part of the country you're in, depends on the drugs you take. But if you add all that up, we're going to be less than $300 for the entire package for original Medicare. So our entire package for original Medicare is going to be less than $300 a month going forward. Now the coverage that you'll have is tremendous. It is nearly 100%. So you only have generally a very small deductible. So generally somewhere in the neighborhood of $200 deductible for the year. That's the entire amount for the entire year. And then the plan's going to pick up your expenses after that. You may have a plan, if we find a better value, that does have $20 copay or a $50 copay, something that's pretty easy to manage. Depends on the scenario with where you're located and how much we're going to use the plan. But anyway, we want to get to where we find the best value, but we want to keep it around $100 a month for that Medicare supplement plan. So with original Medicare A and B, supplement plan, drug plan, where you have fantastic coverage, it's probably going to run about a total of less than $300 a month. So that's probably better than what you're doing currently. Certainly the coverage will be better. Generally, if you're coming off a work plan, an employer plan, you have a much higher deductible, sometimes $2,000, $3,000 deductible plus coinsurance plus copays. Here, a couple $100, and that might be all. So pretty good coverage on Medicare Original. Now, Medicare Advantage, what they show is you pay the Medicare Part B premium. Now, that's confusing to a lot of people. A lot of people think you go into a Medicare Advantage plan, you don't have to pay your Part B premium. You absolutely need to pay your Part B premium. So you still have that $150 a month cost right off the bat, even if you go into a Medicare Advantage plan. And then you also are responsible for co-payments, co-insurance, deductibles, and the plan's yearly maximum. So it does have a limit. Now, where there's an issue with the cost, a Medicare Advantage plan is more of a pay-as-you-go. So it's less on the front side, generally more on the back side. So where we have original Medicare with the whole package, supplement and drug plan being less than $300 a month, Medicare Advantage, you've got the $150 for your Part B, so you're still going to have that. Some Medicare Advantage plans have zero premium, and they include a drug plan. And they can include some other things like dental and vision, but generally it's basic coverage. So it's not anything that's comprehensive. But at the end of the day, when you use it, that's when your out-of-pocket expense will be. And with a Medicare Advantage plan where they certainly have copays and coinsurance and things of that nature, they can have a maximum out-of-pocket of up to $7,550 in 2021. So in other words, if you have a bad medical year on original Medicare with a supplement, you're going to be out of pocket a couple $100. If you have a bad medical year on a Medicare Advantage plan, you're likely to be out thousands of dollars, which can certainly turn a bad medical scenario into a bad financial scenario as well. So one of the reasons that I like original better, and this is just one of the smaller reasons, is you know what you're going to pay. You know how much you're going to be out of pocket if you have a bad year, and it's going to be very low. So it's a good comparison on the cost-wise. Now, when we look at the next thing on Medicare.gov, they talk about coverage. So how does the coverage work between original Medicare versus a Medicare Advantage plan? So under original Medicare, it shows that covered services and supplies, hospitals, doctors' offices, and other healthcare settings under Part A for the hospital, Part B for the outside the hospital. So there's two different pieces of original Medicare. A is stuff that goes on inside the hospital, B is stuff that goes on outside the hospital. Not something you really have to track or figure out, but that's just how they do it. And then you'd likely add a drug coverage plan and probably a Medicare supplement plan to cover the gaps in original Medicare. A Medicare Advantage plan, it says pretty simply that they must cover all services and supplies that original Medicare covers. Now that may be theoretically true, but the difference between the two with original Medicare, you don't really need any pre-authorizations. You don't really need permission to do things that you want to do. Pretty much if it's medically necessary and your doctor says you need to do this because it's medically necessary, that's all you need for Medicare. With Medicare Advantage, you may very well need to, number one, get a referral to go from a primary care to a specialist. Number two, get pre-authorization if it's something of significance. So in other words, ask permission if it's okay. They just make you run through a lot more hoops, and generally not what I want to do when I'm seeking health care. If I have something going on, I don't want to think about somebody else telling me what I could or couldn't do. So I want to be able to go and do what I want to do and take care of it the way I want to take care of it. And that's where original Medicare kind of definitely outweighs on the Medicare Advantage side. Now, the next thing that they talk about is choice. And this would be the number one reason that I do not recommend Medicare Advantage plans and would not be on a Medicare Advantage plan and don't sell Medicare Advantage plans is choice. So with original Medicare, A and B, your supplement, your drug plan, you can go to any doctor, any hospital in the country that takes Medicare, period. You don't have to ask permission. You don't have to see if they're in the network. If they accept Medicare, you can go. And the beautiful thing about a Medicare supplement plan, they don't make any decisions either. If Medicare covers it, they have to cover it. So if a doctor takes Medicare, they have to take your Medicare supplement plan. There's no issue at the doctor's office on which company of Medicare supplement they may or may not take. They have to take it alongside of original Medicare, period. So that's exactly how it works, and that's what makes it so simple. I have thousands of customers on original Medicare with a supplement, with a drug plan, and literally get no customer service phone calls. Nobody's upset with something that didn't go the way they were supposed to go. And that's exactly what you want in your healthcare going forward. Because guess what? We're going to get older. We're going to need healthcare. At some point, we're going to be in the hospital without a doubt. And hopefully we'll come out of the hospital without a doubt. But we want to keep it the way that we want to maintain control over what we're going to do. Medicare Advantage, very likely you have to stay within a network of doctors and hospitals. So it depends on the Advantage plan you have, and some are much smaller and much more localized than others. But generally, even on the big ones, they're going to have a network of doctors in your area that you are able to see. And that network changes from one year to the next. So you may have doctors in it that you like this year, and next year they're gone. Or the hospital is gone, or they have a contract dispute and they're gone, and they're no longer available. And that is absolutely the number one reason that I do not recommend Medicare Advantage plans, because you don't have any control of who you're going to go see. If you come across something significant, if you have a terminal illness or cancer or something specialized where you need to go wherever you want to go, you don't have that option with Medicare Advantage. You can't say, okay, can I go to Virginia and see, or North Carolina or at Duke University or any place like that. You just don't have that kind of control. And if you travel, which hopefully in retirement you're gonna travel, original Medicare, no problem at all. You can go anywhere you want. And with a Medicare supplement, it even gives you foreign travel coverage, where on Medicare Advantage, not at all. If you travel and you have Medicare Advantage plan, it can be very problematic, especially if you have a severe, significant scenario outside of your network. They generally will cover emergency services, but then what they're going to want to do is make you come back into network. So if you're out of state and you have something go on, you may have to come back into network for continued care on a Medicare Advantage plan. So just, to me, crazy to have that kind of restriction in your healthcare. Just wouldn't want it under any circumstances. So that gives you a pretty good, hopefully, idea. And again, understand, I'm a little biased because I don't recommend Medicare Advantage. I could sell Medicare Advantage if I wanted to, but I don't want to, and I don't need to. And I prefer to have happy customers all along the way. That's exactly what I have, and that's exactly what I would recommend for you. So if you have questions, give me a call. We're happy to figure it all out. We're happy to talk about the differences. I have a small team that's here to help and do whatever you need year after year to make sure that we're in the right place all along the way. So I hope you found this helpful. Stay tuned. I'm going to tell you how to download my book right now. Have a fantastic day. Thank you for taking the time to watch my video. Hope you found it helpful. Something you will absolutely find helpful if you're coming into Medicare, or even if you're already in Medicare, is download a copy of my book, Medicare Made Clear. I've spent a lot of time and a lot of effort on this book, and I give it away for free. You'll find that I cover just about every piece of Medicare in this book, and it's easy to read and easy to understand. I've also put videos throughout the book where I explain everything to you. So if you don't want to read through all the information, just watch the videos and I'll walk you right through everything you need to know about Medicare. You'll also find all the links and the guides that you need now, either to sign up or in the future for things that come along. So take just a minute, visit MedicareOnVideo.com/free book. You can download it right now, and it's yours to keep. I hope you find it helpful. Have a great day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please download my book, watch some videos, subscribe to the channel. Have a great day.